Ole. Doctor.
Satish, please switch on your mic.
Language is
Oh,
everyone.
Satish, please switch
Language
on.
is that?
yes, sir.
Konkani?
Dr. Satish said, please mute yourself. Mute that right button. This red button.
Mobile.
Click it. Yeah, that's it. Fantastic.
Good evening, everybody from India, and good morning, good afternoon for all the other countries. At the outset of this talk, I thank Dr. Boramani and Dr. Amulya Sahu for inviting me to this prestigious webinar. And I'm very happy on the behalf of to present all our research and all our work which we have done on methylene blue on behalf of Dr. Deepak Golwalkar from Bhavnagar and Dr. Ramesha from Bombay, Maharashtra. What I'm speaking is on the joint behalf of three of us. And I would like to declare that we have no financial interest. Also, we are not advocating or soliciting anything or anybody's faith. We are just describing what we have learned and done during our research in our hospital, in our families, in our home, and our close kins and friends' families. We are not giving any prescription. All of you are requested to do your own Google and literature search. There are ample evidences, more than 5,200 papers available on methylene blue's various potencies. Let your own conscience and conscience be your best guide. And I request you all to listen about methylene blue without prejudice, with open-minded to embrace it. And before I begin my talk, I want to thank all of you for your patient listening. This talk is going to be long. Methylene blue has 135 years of history, so even if I dedicate 1 or 2 slides for every year, it's going to be a 200 slides presentation. And the moderators will have full right to interrupt me wherever they feel like. If you want to ask any question, don't cut down me.
Dr. Golwalkar is a good singer. Hello. Please unmute yourself, Dr. Golwalkar.
Hello. No, I'm not a good singer. I'm a Santur player.
Santur player. And
yes.
You're a disciple of Pandit Shivkumar Sharma.
Yeah. He has blessed me and I'm happy in playing.
Thank you, sir. Yeah.
I enjoy playing.
Yeah.
Thank you very much. Dr. Kakadi has exhaustively covered all the aspects of methylene blue. Now, I would like to share my experiences and the way I'm treating patients and what precautions I do take. And hello? Can you hear this? Hello?
Yes, sir, we can hear you.
Yes, you can hear me. No?
Yeah.
Now, I'll start with the way everybody asks me how you got the idea of treating with the methylene blue. Now, it goes back to 1979 when I was a student and I was asked by my professor to diagnose the bronchopleural fistula. And we used to still inject about 50-60 milliliter of methylene blue into the chest wall, and we used to diagnose with the methylene blue. Hello, you can hear me, no?
Yes, sir.
Then, but then at that time I was noticing that whenever I had performed that broncho diagnosis investigation with the bronchopleural fistula, the healing was better. But then it was registered in the back of my mind, but then I had stopped thinking about it, but I never thought of it. But then I'm pioneer in starting nebulizer therapy in Gujarat and our state. And when I started nebulizer therapy in state, I had the desire, I had an idea to treat TB with nebulizer. Since then, one fine morning, I got a click that if I can use methylene blue in nebulizer, it should work. To take the advantage of its property as a bactericidal, a virucidal, fungicidal, I thought it can, because by that time I had started getting XDR patient where there was no hope of any survival. So I started using it, and to my surprise, I started getting good results. 50% of the XDR patients started recovering. And then when I found that it is they are recovering, what dose I have to give? Now, then I noticed there are a lot of antifibrotic activity of the this drug. So नहीं पाठीमागचं कर. नहीं, yes. Okay, sorry for नहीं back कर. Back. Back again.
Are you showing your
Yes,
slides,
yes,
sir?
yeah. No,
Please
no,
share the slides. We can see.
Yes, yes, yeah.
Yeah.
Then I found that significant success in MDR. First I tried in XDR, then in MDR, and then I noticed that antifibrotic activity may help me in treating ILD patients. Patients, I thought because it is an collagenous disorder, if I can take help of sublingual or systemic some help from methylene blue, I started using sublingually also. Sublingually for the reason that I wanted it in the bloodstream, because sublingual is the fastest way to enter into the bloodstream. I started with 5 milliliter or sublingually, but patients are not tolerating better way. So I reduced it to 2.5 liter, and the results were very good. Acceptability was also very good. Then I noticed the antifibrotic activity. See, antifibrotic activity I noticed in interstitial lung disease as well as in tubercular fibrosis. You can see the left side, the patient had extensive tuberculosis. This is one of the patient. I must have treated at least 10,000 patients, but one of the patient, and patient had come in a very bad shape. Doctors were challenging me that he will not survive. I said, if he stays for 5 days, then I can guarantee you, challenge you that he will survive. And then this is the final result on the right side. Minimal fibrosis is there. Antifibrotic activity, then I thought of it using it in interstitial lung disease. Even there, to patients of interstitial lung disease with, if they are not having clubbing, and after walk test, if the saturation going down and returning within 10 seconds, I assured that you will have no problem, and they are recovering very fast. Now, in the phase of this COVID, post-COVID fibrosis, you can see on the left side extensive fibrosis. Patient had come from Surat with 80% oxygen saturation. I admitted him for 3 days. 4th day I gave him discharge. 3 days he has to be oxygenated. And 4th day I gave him discharge. This is the final within 2 months. Now my observation is that tuberculosis, antifibrosis takes 6 to 8 months. In COVID fibrosis, it takes 2 months only, 2.5 months. Within 2.5 months, it goes back to normal. And in some patient of tuberculosis, casio-pneumonic lesion with cavitary lesion, I have found that total resolution, no evidence that patient, even though patient was put on positivity was there, casio-pneumonic lesion was there, cavitary lesion was there, but at the end, I couldn't see a single evidence that patient had TB. So that is something unexplained phenomena. I always invite the researchers to find out the possible present way of mechanism of action of methylene blue doesn't explain this phenomenon. This is in COVID, I'm more happy because in my opinion, it is an acute phenomenon. It is an interstitial edema more than fibrosis. Because in TB, what happens, there is a shrinkage, atelectasis, loss of volume. It takes some longer time. But here you can see, this is one of the patients. I got collected X-rays about 70 patients where this fibrosis has been reverted, and they are very much happy now. Now, regarding the TB, COVID, I would like to say how I treat it. Now, the symptoms of COVID are fever, low grade, everybody knows, uh, with or without rigors, loss of taste and smell, along with heaviness in the chest. That is very significant. Coughing with no expectoration. Patient will go on coughing, but no expectoration because Dr. Kakria had shown that it is plastic-like. It is adherent to the mucosal wall of the bronchi. So you don't bring out any sputum. Disproportionate weakness. If you have got a flu, but with some paracetamol or antihistaminic, you can attend your clinic, but here patient is restless. He said that do something, I'm very much weak. I cannot get up. That is most important. Does not complain of breathless. Patient, though despite he is having 70% oxygen saturation, he doesn't complain of any breathlessness. And one more observation I have been doing, and that I am using in my clinic, change of skin texture. Normal shining of the skin texture is gone. There is a dull skin. You start observing. I always say that patient speaks of face itself speaks. The luster is gone. It is dull. Then you can suspect that the patient has got something serious illness and think of it. Now, practical tips of the doctors. See, if a patient comes to you, 20-meter walk test. Why I'm saying every patient is not COVID positive, but if you suspect, if you see the oxygen saturation, because what happens, every time it is not positive, patient doesn't come with HRCT, he comes to you first, see the oxygen saturation in the blood. If it is 97, ask him to walk 20 meters. 6 meters we cannot, otherwise we will end in trouble. But 20 meters is enough. Ask him to walk for 20 meters rapidly. Call him back and put the pulse oximeter. One very important and practical thing I would like to say, if he goes with 97% oxygen saturation, he comes back, you measure, it will be 97, but it will start falling at the end of 20 seconds, 15 to 20 seconds. It will fall to what level it goes down. That is you will get an idea to what extent the damage has taken place and how much time it takes to come back to normal. That is very important, because all the patients you don't get HRCT or positivity, rapid test positive, you don't get in all the patients. Second thing, X-ray finding. Now see, in pneumonia or any other illness, you get big shadows. Here you get very floppy shadows. Train your eyes. You are all are ophthalmic surgeons, but we are dealing with lungs. Train your eyes. The lungs X-ray itself will tell you. You can find silver line sticks. You get floppy shadows. They are diffuse floppy shadows. They are not localized to one segment or any lobe, but they are diffuse shadow with silver lining. Silver lining is because the clogging of the fluid in the bronchioles. They give and the peripheral bronchi, they are not routinely visible. Only in good X-ray and trained eyes of our chest physicians, they can see the peripheral bronchi. But here you can see I have pointed out the bronchi, they are peripheral bronchi. Normally they are not visible, but you can see them. They are silver sticks. They are significant, and they are suggestive that there is some interbronchial clogging is there, and they are giving this shining appearance. Third thing, bronchi are tortuous. Normally, you don't get straight line, but in COVID, you get, because of the filling of the material exudation, they become straight like a wire, straight wire. So that is another thing I have seen. If second thing, if you examine a patient, I'm examining, people are not examining unfortunately, but I'm examining. If you get a bronchi, be sure that the chances of COVID are remote. So if there are bronchi, because here you get silent chest. Patient is not complaining of any breathlessness, but if you auscultate him, you get a silent chest. That is very important. Now, treatment part, I would like to say prevention is better than cure. Methylene blue is best used for methylene blue is best used for prophylaxis. Methylene blue nebulization to be added for COVID-19 positive patient. In hypoxic severe viremic IV may be given. If you suspect COVID, again I will give you, if you suspect, not confirm, but even if you suspect, immediately give inhalation of MB, dexamethasone, salmeterol, ipratropium. Do not wait for the confirmation. Do not wait for the confirmation. Sometimes patient comes to me with 70% oxygen saturation. He's not in a position. If I start giving him inhalation immediately, it will go down to 65 or 60. I will land in trouble. So what I do, I give him oxygenation. I oxygenate him, bring his oxygen level to 80, 85 or more, if possible more than that. Then I give inhalation of these 4 drugs combination. Then I send him to the hospital. This is important because moment you give inhalation, the further damage is stopped, further fibrosis, chance of fibrosis are minimized, and patients recovery is very fast. Now, how do I treat the patient? If the patient has oxygen saturation in my clinic is 95%, can be treated as an outdoor. If oxygen saturation 90 to be observed critically, if you are sure that he will keep in touch with you constantly, you can treat him as an outdoor patient. But if the patient's oxygen saturation is 85, hospitalization is needed. Sugar, if diabetic, it goes up. Even if he is not diabetic, it goes up. Sometimes, I don't know, that goes up to a great extent. It goes up to 350, 400. But what my observation is that don't treat with tablets, go on measuring sugar and treat with insulin only. If with COVID, if you have hours, not days. So I'm keeping my OPD till night because any COVID patient, I don't want to call him next day. I have to spend some more extra hours, but I'm worried about that patient because next day he will be in trouble. So you don't have days, but you have hours only. Mass singular sublingual methylene blue as a prophylaxis is the best approach to overcome this pandemic. As the Dr. Kakade has told in his lecture that 2000, more than 2000, I think it is, because I have been treating since the lockdown, it is more than 2000, but I'm advising all the relatives of the patient to take methylene blue sublingually as a prophylactic, treating the patient. Not a single family member of the patient has yet developed COVID, and as on these guidelines, I have been treating the patient. By God, I have not lost a single patient. Some patients are critical, but they do recover. Thank you.
Okay, so thank you. Stop sharing your screen. We'll be continuing with our discussion before going to the next topic. But we have with us Mr. Mehul Chaturvedi, who is a senior MR in Nicholas Piramal. He has to leave the meeting because of some urgent family emergency, but he wants to share his experience because he has gone through a harrowing experience of COVID and how he was saved with methylene blue. Mr. Mehul, you are there?
Yeah.
Yeah, please share your experience.
Yeah. Sure. Yeah, this is Mehul Chaturvedi. I'm an experience of 35 years practically in the medical professions. Since 35 years I'm in the medical profession, and I'm a good friend of Dr. Kakadia also. Basically, I have been encountered with Corona for around 12-15 days, 16-17 days back. I found a positive.
Please unmute yourself. We can't hear you. Please unmute yourself. Yes. Yeah, come again.
Yeah, you're getting my voice now?
Yes, now it is there.
Okay. So I got encountered with the COVID before around 15 days back, and the thing was that my temperature was not going down somehow, and even after 12 days, 13 days also my temperature was going 101, 102. And suddenly I remembered Dr. Kakadia. Dr. Kakadia called me at his office, his clinic, and given me the importance of two things. Of course, methylene blue, he has given a equal importance, but he has given importance to the UV rays also, which he has invented with the help of his own creation. So he has given me that machine also. He has given me the methylene blue also. To my all surprise, because I trust Dr. Kakadia. I never trust methylene blue or anything. Because I trust Dr. Kakadia, I took it for 2 days, methylene blue and that UV rays combination. And surprisingly found on third day, rapid test goes negative immediately. This is something very miraculous for me, that which has gone completely negative, and I have gone for a rapid test which was negative. Then I gone for the other test. Then the other parameters also started going down, like D-dimer and CRP, WBC. So so this is the first time experience for me. Now I'm sharing this experience with the other people, and I'm thankful to Dr. Kakadia for such a good prognosis for that. Thank you very much.
Mehul, tell us how quickly your fever was gone after 40 days.
That is what I told. No, within 24 hours, the fever is gone. Within 24 hours. Next day only the fever is gone, which I found a surprise that how it comes. So I went for rapid test on next day. So second day, I found the rapid test is negative, which is very miraculous for me. And of course, I was trusting Dr. Kakadia. I have started trusting more. That's all.
Okay. Thank you, Mehul. Thank you for giving time. You
sir.
can leave the meeting whenever you want. Please apology for holding you back.
No, it's okay. My father actually is not well, basically. That is the only point.
I know.
Otherwise,
We'll continue our discussion, but in the panel, there are 3 physicians who are very busy with their COVID patient. Now also, one of them is in OPD himself. So we'll take their opinion first. Dr. Rakesh Kalathia is there with us, and Dr. Vishnu Patel. Dr. Vishnu Patel's son is Dr. Nihar, who is a pulmonologist who is treating a lot of COVID patients, and they have got a lot of things to tell us. Let them.
Mehul, switch off your mic.
Oh, sorry.
Yeah. So let them share their experience so that they can also be relieved whenever they feel like. Dr. Vishnu Patel, Dr. Nihar, and Dr. Rakesh Kalathia. They are the physicians who are actually treating the COVID patients. Yeah, Dr. Vishnu Patel, you can start.
Okay, first of all, it's really nice that ophthalmologist people have taken great interest in this corona pandemic, and the way Dr. Kakadia has taken initiative for usefulness of this methylene blue, and which has benefited so many patients. Starting with my experience with methylene blue, when I was resident, we used to treat so many patients of aniline dye poisoning in Baroda, because Baroda and Ankleshwar were chemical hub of not only Gujarat but all over India. So we were treating so many patients of aniline dye poisoning. The similarity between methylene blue poisoning and this thing corona is that both the patient which had desaturations to a great extent, but they were quite happy. They were not breathless. I found that maybe the cause is same, the presentation is same. So along with other physicians friends, we started using methylene blue. We were using methylene blue IV as well as nebulizer, and we have made a routine in our practice to start methylene blue IV as well as nebulization. And I had very good support of my son, Dr. Nihar Patel, who has done MD as well as DNB in pulmonary medicine. He's an interventional pulmonologist. But because of his support, I had also started COVID patients. They were all happy. Second, the most important thing I would say about outcome, that patients who had treated with methylene blue, the sugar level has gone significantly down very early. The patient now, so many patients has come with blood sugar level of around 700 milligram. But once we start methylene blue and insulin, the insulin requirement also goes down. That is the one observation I would say. And second thing, after follow-up, when patient comes, they are very happy. They says, sir, we are feeling much better now, even better than the before we got corona. So this is second observation. So routinely we use methylene blue and the patients are happy. Two things we for patients with impaired renal function, the dose of the methylene we don't give them IV, we just give them inhalation only. And for other patients, we give 1 ampule of methylene blue in infusion daily for 3 to 4 days, along with our routine and later stage anticoagulant oxygen as well as steroids. So we are happy with methylene blue. We are using it, and we recommend that as it is very least toxic or drugs without any side effects, it should be used because as Dr. Kakadia has extensively narrated the history, the usefulness, the chemical structure, that the drugs can be used as antifibrotic, as antiviral, as anti-inflammatory, anti-aging, antipsychotic, and so many antioxidant, reducing the oxidation, and it increases the mitochondrial respiration. So everybody should use it. We are happy that we are using for the last 3 to 4 months, and we are sharing this experience with them. And I thank Dr. Kakadia as well as all the team that you have given us such a platform to represent our experience with this. Thank you.
Yeah. Thank you, Dr. Vishnu. Dr. Pamela, please wait. Let Dr. Nihar Patel share his experience, because he is a pulmonologist who is day in and day out is treating a lot of corona patients. Dr. Nihar, please.
Yes, thank you, sir. I'm audible right now?
Yes, yes.
Yes. So as I thank Dr. Jagdeep, sir, to give this opportunity, and like my father said, we are starting using methylene blue since last 3 months. Our protocol was simple. We divide the patient according to their symptom, which have the antigen and rapid test positive. We have started with remdesivir. Our protocol was there not to stop other antiviral drug. We have given along with the standard treatment the methylene blue. The protocol was simple. We give 10 mg per ml, so it comes to 100 mg of methylene blue into 50 of NS, consecutively 3 to 4 days, with the nebulization form of 2.5 ml 3 times a day. Along with nebulization methylene blue, we have used 4-meteryl budesonide combination. As Dr. Golwalkar is using dexamethasone and salbutamol, we are using 4-meteryl budesonide, which is come as a form of workout. We have experienced that along with all this treatment, the patient's recovery rate was very better. In single arm, when we are not using methylene blue, the treatment patient got, they discharge after 8 to 10 days. But subsequently in last 2 months, when we started with methylene blue, the discharge period came down to 5 to 6 days, along with the standard treatment of remdesivir. And we have used steroid. We have limited our use of steroid in some patient only, or in the time of secondary cytokine storm peak after 7 days only. So along with remdesivir, we are using mainly methylene blue, and outcome is very satisfactory. And as my father has said, the patient has very less side effect. We have used in CKD patient also with limited dose also. So thank you all, ophthalmologist team, to give such opportunity to speak for the COVID.
Thank you. Thank you, Dr. Nihar, for your wonderful inputs. Is Dr. Rakesh there? Dr. Rakesh Kalathia. He is another corona warrior from Surat, and he has prevented many admissions for COVID patients and treated them at OPD level only. Dr. Rakesh there? Dr. Rakesh Kalathia. Okay, by the time he joins, I would like to ask Dr. Namrata Sharma to give her comments on the deliberation so far.
I think it was a very impressive presentation and on methylene blue, and I have heard this presentation before when Dr. Kakadia sir had given it, Jagdeep Kakadia sir had given it at another platform. But frankly speaking, at that time, I did not believe in it so much as I believe in it today, for the reason that, the entire systemic entire systemic features were covered, and it was in very great details that he showed all these studies and everything, not only related to the eye but also related to the systemic part of the patients, and more so I think it becomes believable because all the pulmonologists are also there with us who actually treated the COVID patients with this. At that time, I didn't think it had so much of potential, but today, by the way, the physicians are here, pulmonologists are here, and even the patients themselves, some of them who've been treated by methylene blue are here. They stand to the testimony and the fact that methylene blue really works. To me at that time, frankly, it looked as though it was being looked at, like any new thing that comes up or anything that comes up and becomes a panacea for everything. So, it looked like that, it helped to treat one virus, and then so it was not specifically targeting the COVID-19 virus, but it was, encompassing several groups of viruses. But today, by the presentation and by the deliberations and by the discussions, it doesn't appear to be like that. I'm thankful to Dr. Sahu sir and to you as well that I was a part of this, deliberation today, because it looks extremely convincing today. I mean, I would now say that, it is convincing, and it stands the evidence, whatever is there clinically as well as based on the literature. I just have a couple of questions. One was that it is often seen that when you give, I believe and I presume that steroids are not stopped. So it is often seen that when you give steroids, people, especially who are steroid responders, might have their blood sugars increased, and it has happened in my one of my own relatives, where the blood sugar increases because classically in the hospitals they give only remdesivir and steroids. So what is the effect of methylene blue on blood sugar? I mean, will it remain the same? It will decrease, or will it increase further? And second thing, I think that question is answered, that you don't stop any other drug. Methylene blue is continued as an adjuvant with the entire treatment protocol that is there for COVID-19.
Yeah, I think Dr. Kakade has explained about the drop in the sugar, but you can explain, Dr. Kakade.
Yeah, Dr. Ramesh, I also would like to speak on. As Dr. Vishnu said, it increases the sensitivity of the insulin, so the insulin requirement decreases. And by default, because it increases the mitochondrial respiration, the glucose consumption is so much as if you have walked for 4 to 5 kilometers. So your sugar level decreases by 70 to 80 milligrams per day, just by taking oral methylene. I'm not talking about IV. When you give it IV, the sugar level goes down further because of the increased metabolism. So definitely it helps in reducing the blood sugar. That is one thing. Second thing is Dr. Rakesh Korothia, once he joins, he has been treating, and with him some of the patients I also have been treating just by methylene. No other antivirals, no favipiravir, no remdesivir. You really don't need anything. You just need 2 or 3 injections of methylene blue and all the viruses are killed. Because methylene blue is not an antiviral nucleotide, it is a electron bombarding drug. It's basically a chemical which will kill all bacteria, all fungi, and all viruses. So, of course, Dr. Namrata has her own position at AIMS. And everybody is, yes, sir, please.
No, I would like to share my observation.
Yes.
When you get the infection, the sugar level goes up. And then after the treatment is over, it takes 15 days to come down to normal. In diabetics, if I have given methylene blue for prophylactic, it comes down, it remains around 200. But initially in all the infective patients I've seen, I have to treat them with insulin, and then after it takes 15 days, not immediately. That time when you get an infection, it goes up. You have to titrate and go on giving insulin. And when the patient recovers from the corona, COVID, then it comes down to back to normal. So initially you have to titrate and go on giving insulin. In all the patients, this is what I have seen. In non-corona COVID patients, in diabetics, the first observation I've seen that every patient said that leg cramps have gone, which is the commonest problem with the diabetics. But the 10th day they said that they have got sense of well-being and the leg cramps have gone. That is what I have observed. But and sugar level goes down, it remains around 200. He doesn't become normal, but it moves around 200. That's what I have seen in so many years.
Okay, thank you, sir. We have expert panelist Dr. Ramesh Shah who want to say something. Followed by that, there are questions. 2 questions we'll take, one by Dr. Prakash Marathe and one by Dr. Carla Pamela Gonzalez Daher. But Dr. Ramesh Shah, your expert comments, please.
Unmute yourself.
Please unmute yourself.
Dr. Namrata, we have treated one very severe corneal ulcer. I think Dr. Kakadiya showed in the beginning. I think probably you were not there in the audience.
I came late, yeah.
I treated that thing, the severe corneal ulcer in the blind eye. So I had the opportunity to treat and take the liberty. The whole cornea was almost gone. And we gave a UV light for 2 days, and third day onward we started giving 0.03% of methylene blue eye drops prepared by one of our ophthalmic company. And the 4 days to 5 days, the whole cornea became clear and the eye became very quiet. So this is another alternative which we will have to think about in our ophthalmic field. I treated 3 of the conjunctivitis and 2 of adenovirus with the same methylene blue without any other medications. The other thing which I started treating is herpes of the forehead. So that is the only thing which comes to our practice. And 4 of the patients were treated twice, 2 days with UV light. And the third day, I prepared the methylene blue skin ointment by mixing with Nivea. And then we gave it to the patient to apply on the foreheads. And to my surprise, the full forehead which was involved got cleared in 3 to 5 days after starting the methylene blue skin ointment. This is locally prepared. It is not a scientific way of doing it, but I still did it because I was very confident that methylene blue definitely will help even in herpetic lesions of the skin. However, this requires a longer study, proper protocol followed and proved that it is really working. So what I am trying to tell you is that methylene blue is going to be a wonderful drug even in our own field, ophthalmic field, in treating corneal as well as the conjunctival infections. In fact, I am very seriously thinking instead of using betadine wash, I would put 1 drop of methylene blue before my cataract surgery.
I was about to ask that do you think it is going to replace povidone iodine for prophylaxis?
Because the difference between methylene blue and betadine is that betadine does not penetrate the cell wall, but the methylene blue penetrates the cell wall. So even the intracellular organisms can be killed with methylene blue. So I am very seriously thinking from next week, I have few drops still with me. It is prepared by one of our ophthalmic company. It is 0.03%. I had given few of them to Dr. Kakadiya. Dr. Namrata Sharma, in case you are interested, I can send 20-30 drops to you to help us to prove, because you are in an institution where you can do this better than us. I can give it to you. I can send it to your address. If you can send me the address, I'll send 20 bottles to you. Please try it and help us to prove so that all of us will benefit with small amount, our small contribution in ophthalmology.
Surely, I think we could try this. And more so, we are getting so many, corneal melts and there is no tissue available. I think we should try it.
So if you can send me the address, I'll send the drops.
I will.
I'll send you the drops.
Yeah.
Thank
you, Dr. Kakadiya.
Yeah, thank you, Dr.
Dr. Boramani, after the panel discussion, I'd like to show to Dr. Namrata Sharma these 3 corneal ulcer slides.
Sure.
Just allow me afterwards.
Yeah. In fact, I have treated 2 herpes zoster ophthalmicus skin lesions with UVC, and the results, the recovery is very fast. You have to experience that thing. Dr. Prakash Marathe, your question, please.
Yeah. Good evening, everybody. I think it was a wonderful presentation by Dr. Kakadiya, Dr. Golwalkar, and Dr. Asisha. Now the thing is, the whole world, not only India, is passing through this phase of COVID era. And there are trials, many more trials with many more drugs, that this COVID is not getting into control. Now, when various drugs are tried and methylene blue and other therapies what these people are trying, they are giving fantastic results. Why not to take this particular issue and these particular drugs to the higher level, like Indian pharmacopoeia, British pharmacopoeia, so that these drugs can be used all over the country, all over the world, and whatever is needed in this particular direction, there are stalwarts from the field of they are physicians, they are ophthalmologists, and on various positions. I think this must be tried. That's what I feel. So the use of this particular drug should be available to all the public across India as well as across the world. Yes, sir. RC sir wants to say
Dr.
something.
RC will answer that. Unmute yourself. Yeah.
See, we,
What is Dr. સાહેબ તમે કોને વાત કરો ને
કહું. Sir, Dr. Boramani, we would like to hear Sanjay Paranjpe. Advocate Paranjpe is here.
Yeah.
And with his help, we have distributed so many thousands of bottles of methylene blue in Bhavnagar area that we are almost nearing extinction of COVID in Bhavnagar area. And our target is that by Diwali, we will have 0 cases. We would like to hear Dr. Sanjay. You have been phenomenally distributing methylene blue in Bhavnagar district.
I am very much thankful to all of you for inviting me and giving the platform.
ઓડિયો નહીં આવતો ઓડિયો આવે પૂછો
ઓડિયો આવે છે પણ સાઈડ માઇક માંથી શરૂ કરો ને.
Unmute yourself.
Hello.
After,
Are you getting me?
Yes, we are hearing.
Yeah. So I have seen that most of
please unmute yourself, sir. Okay, we can take up Dr. Carla Pamela Gonzalez's question first.
Please.
Then Dr. Paranjpe will join. Dr. Carla Pamela, please.
Yes, thank you very much, Dr. Jadik, Dr. Divak. Congratulations. It was an excellent presentation. For me, this is a novel subject since I have no experience with methylene blue. I know it's been used here in Mexico for the transfusion, for the plasma transfusions to inactivate the virus, but I don't know if it is used as prophylaxis. So you were kind enough to explain us the way to prepare the different ways of taking methylene blue and prepare it yourself at home. But I'm curious, is there a commercial dose available in any part of the world, or it is not, and you just have to go on and prepare it yourself?
Ma'am, in every country, every member nation of United Nations, it is the WHO's compulsion that every country has to have injection methylene blue ready and available wherever there are chemical industries. Because methylene blue is the only drug which can reverse cyanide poisoning, which can reverse nitrite poisoning, which can reverse aniline dye poisoning. So injection methylene blue must be available in Mexico or any part of the world. Number one. Number two, you ask any of your neurosurgeon friend or any of the gynecologist who is treating vesico-vaginal fistula, they use methylene blue to detect the fistula, so they must be having injections available. Injections are by default compulsory to be kept available in every member nation of United Nations. So injectable methylene blue must be available. If you can't get that, you can approach any science college which is having a biology laboratory. You just ask the professor of biology of higher secondary school or a microbiology department of any science college. They must be having methylene blue because they use methylene blue for various bacterial staining, acid fast bacilli staining, gram staining, everywhere methylene blue is used. So any chemical supplier who is supplying methylene blue powder to the science college laboratory or to 11th and 12th science higher secondary school laboratory will be able to supply the powder and you can make it yourself. The easiest is to get one injection of 10 ml, dilute it into 90 ml and make 100 ml, and then you already have the British or USP grade of powder.
Okay.
Thank you.
Thank you. Mr. Sanjay Paranjpe, please. We can't hear you,
Oh,
sir.
we can't hear you. Tamaru, Sanjay, your mic is not working.
Hello. Are you getting?
Yes, now we can hear.
I'm very much thankful to all of you to giving me an opportunity to share with you with patronage and whole heart blessings of Dr. Golwalkar. I am able to do all these things. We have reached to the people, those who are infected, to their family members, nears, dears, and their relatives. We have given bottle pack like this 200 ml bottles we have prepared. Most of the journalists and other people who were working for a day, they were sitting in the evening in my office and all were preparing this, and next day morning we were distributing in the areas. Likewise, we were able to control it. But one thing is that as per mention in medical jurisprudence and taxology of H.W.V. Cox, it is clear-cut mentioned that doctors must do such a treatment which is in benefit of the patient and not benefiting to himself. But why this is not propounded by many of the doctors, I am surprised. Even the medical council and so-called as the people who are sitting at top level, I think that they have blocked their mind. They should open their mind in the vital interest of people, those who are starving like anything, to live and survive. And in most of the cases I have seen that unnecessarily doctors are giving injections of remdesivir and telizum and fetching and grabbing lot of money unnecessarily. Even I have seen in many cases when the oxygen level of patient is 90 to 95, they are showing on paper that they are giving 8 to 10 kilo of oxygen. How it is possible? What? Ramesh bhai, what?
Yeah, Dr. Ramesh, please.
Yeah.
No, please complete your thing. I want to tell something beyond yours.
Okay. So, one day at 11:30, one doctor from Surat, he was crying on phone with me that 13% of his family members are infected by corona, and his parents, his father was 90 years, mother was 85 years, were on a ventilator, and doctors have raised their hand, they will not survive. But with the help of this methylene blue, they all have come out of corona. And now they all are happy. One patient in Bhavnagar also, with guidance of Dr. Golwalkar, we have treated. The person was consuming 60 kilo of oxygen, having many complications, undergoing treatment of a cardiologist at home. He was infected by corona, and by the treatment of Golwalkar sir, the patient came down. Within 5 days, he started consuming oxygen 2 kilo only per day instead of 60 kilo per day. Now I can say that if we can get this result, why other doctors are not promoting this? What is harm in this? I can't understand. But this is the time that all of you, those who are interested, must come out with local media, with local support. We must not fear of any government hindrances, because it is constitutional right given to the patient that whatsoever treatment is beneficial to the patient, with permission of the patient, doctor is duty bound to give. So we can remove orthodoxy of mind and rigidity of the mind from other doctors, those who are not following these treatments, and they have closed their mind. They are not following for the benefit of the patients, but they are more interested
in filling their pockets. Thank you.
Yeah, Dr. Ramesh, please.
Now I'll share you more experience about the methylene blue. I had 3 patients who wanted to go for cataract surgery. So one eye we did the cataract surgery, patient could not even walk for 3 steps because of the interstitial fibrosis. Then I told the patient that why don't you take a inhalation of the nebulization of methylene blue. He took it for 15 days, and to my surprise, when he came next time he came walking. This is after 10 years of interstitial fibrosis. And he demanded that you get my second eye cataract done. I said, you don't do it here, you will do it in the institution. He said, no, I'm very good, I'm very fine, I'm very thankful to you. And ultimately got the cataract at my place after 15 days of the other eye. There are similar 2 patients, similar conditions also got it done after 15 to 20 days of methylene blue. And they got relieved of the symptoms which they have not received for last many years. This is another 2 experience which I have. The third thing is that we are distributing methylene blue in Bombay. I must have distributed more than 3,000 packets to 3,000 families. In my own family, my in-laws, 4 patients were positive. They got cleared with methylene blue and UV light in 2 days to 3 days time. My own brother, my Bhabi, everybody had positive, and all of them got treated. In my own building, we treated about 4 patients. All around my, whenever they come in contact with me, I give them methylene blue powder, I give them methylene blue injections and UV light. All of these things are done free of charge, and not a single patient is deteriorated so far. Everybody got cleared with methylene blue and UV light. This is my personal experience, and to the extent that probably must have treated more than 3,000 patients, families with methylene blue, and we are still distributing more powders. We are sending the powders wherever there is a scarcity, especially in Gujarat. We send it about 1 kg powder in small preparation in Rajkot, some 2-3 places where the Swaminarayan Sangh is asking through that their devotees in Mumbai. So wherever there is a demand, we will send the methylene blue. And any of this, including Bahrain, Dr. Kakadia, with the help of Dr. Kakadia, the Bahrain embassy people came and collected the methylene blue, as well as they collected the UV light for the treatment in their country. So this is the power of methylene blue and UV light.
Dr. Praful Vaidya, who is the personal surgeon of Sheikh of Bahrain, I think probably he was here.
I think he has joined here.
He has joined here. Maybe we can invite him.
Yeah.
Sir, yeah, I had shared the ID to him. He had in fact logged in, but now I'm not able to interact with him.
Okay.
So
please ask him to come in.
Yeah, I tried calling him also.
Yes.
I
Dr.
tried
Parikshit
calling
want to say something. Dr. Parikshit, please. Can't hear Dr. Parikshit. Your voice is not coming.
Dr. Praful Vaidya, I can see him here.
Boramani sir, can you hear me now?
Yeah, now we can hear. Yeah.
Yeah. So I had just wanted to say that it is very impressive the work that Dr. Kakadia and Dr. Shah and Dr. Golwalkar have done. I mean, hats off to them and their innovation and the great philanthropy work that Mr. Sanjay Paranspe is doing by distributing methylene blue in the various poorer communities. It is definitely something that we need to appreciate and we need to applaud. But at the same time, we have to understand that the evidence that methylene blue works perfectly against coronavirus is still scientifically very slim. These are very difficult times, and almost all the treatments that are there other than oxygen, all the antivirals and all of them are given in an empirical basis. And to some extent, that is true about methylene blue itself. So at least in a scientific forum, when we present, we should take the scientific merit also in consideration. It is good to help people, and people do need help. But I can also say from my personal bit, my father was affected with COVID. He was given methylene blue, later even IV methylene blue. But well, unfortunately, it did not work. He did not have any comorbidities, but still, I mean, the outcome was not good and he passed away. Methylene blue, yes, definitely it works for some people. It may be working for a lot of people. But to make a claim that methylene blue will cure antiviral this without any proper histopathologic basis, I mean, more research is needed before we can say that. That's all I want to say.
I think Dr. Kakadia can answer that.
Yeah, that's unfortunate, Dr. Parishit, that we lost your father. See, basically we are solo private practitioners, so we do not have the institutional setup to do the studies. But I've shown you that on 135 patients who came positive on Monday morning, we gave methylene blue Monday 12 o'clock, Monday 8 o'clock, on Tuesday morning, and then on Tuesday evening when the rapid antigen test was done from the nose, they all came negative. That is one evidence which we could get, because in the lockdown days or before some time, it was impossible for a private practitioner to get an RT-PCR done by a private lab. So we don't have that capacity to generate the scientific evidence. What we are presenting is that what we have found, and it is for the institutional head or like the person like Dr. Namrata Sharma, who is the secretary of AIOS, who is an expert in designing the studies. Maybe they design a study and take it up at a higher level. We have found. So that was one thing. The other study which we did was that if a patient comes positive from right nostril swab, you put methylene blue in the left nostril, and after 40 minutes you do the rapid antigen test from the left nostril and it will come negative. I have done that for 30 patients. And then you put methylene blue in the right nostril, and after 40 minutes you do it again, which has come positive before 80 minutes will come negative. So methylene blue instantly kills the viral antigen. It destroys the virus, that is for sure.
Definitely, sir, but it cannot do it for the entire body, even if it is given orally or intravenously. Locally, it perhaps needs. So as you said, we need a larger and a more properly designed study for that.
Yeah, I agree with you. I fully agree with you. There are more than 30 studies which says that 90% of the viral load is in the nose, paranasal sinus, and in the throat, even in an infected patient. Only 10% of viruses are either in the lungs or in the blood. So even if we kill 90% of the load, most of the patients will start recovering. Maybe in your case, the methylene blue was probably started very late after the cytokine storm had already been established.
There was no cytokine storm. It was on the third day, but that's okay. It's a personal day. So let's not get into that. We're discussing the science now.
Yeah, right. So what I mean to say is that it works in a very large number of patients, maybe 95% plus out of 100 people. So if something works in 95 out of 100 patients, the institutions should open their mind and take up a study. We are solo private practitioner. As a solo private practitioner, it's almost impossible to get.
But a lot of institutions are doing the study. So I think we will perhaps hear from them.
That's good. That's good. I mean, as soon as we can hear from them.
Dr. Kakadia, can you show the pictures of corneal ulcer to Dr. Namrata, please, if
Yes.
Dr. Puramani permits?
Yeah, please let him show. And Dr. Satish want to say something.
Yes, sir. Yeah, I wanted to add to Dr. Gopte's question. See, I lost my cousin who was the surgical distributor for methylene blue. He has supplied to nearly about 100 doctors in other part of Karnataka and southern Maharashtra. So, yeah, he landed with a cytokine storm, and he actually wanted to intervene and give IV methylene blue as per the advice of Dr. Golwalkar and as well as Dr. Kakadia. But the family was very, very reluctant, and they did not allow us to intervene for IV methylene blue. However, we only nebulized, and as Kakadia sir has told, that methylene blue works in at least about 24 to 48 hours. It takes so much of time. And the other day, I had a medicine professor who just told me that methylene blue we tried just because there was nothing else available. So there is a specific time as to when you use the methylene blue. So just before the cytokine storm sets in, that will be the ideal time, because there is hardly few hours for the patient to respond, and sometimes they succumb to that. So the conclusion is just straight away made that the patient did not respond to methylene blue, which is actually not the case. That's what I wanted to highlight it to this panel. Thank you.
Yes, Dr. Kakadia.
Please share the slides. Yeah.
Yes. Dr. Navrata, this was the suppurative keratitis on day 1, where 4 millijoule per centimeter square energy UV light was given on day 1 and on day 2. And on day 3, the infection got cleared, the cornea started healing, and the epithelial defect was only this much. On day 3, methylene eye drops 0.03% was started. And on day 7, you can see that the cornea has fairly cleared, the fibrosis has started reducing, and the methylene blue drops going into the corneal lymphatics and into the ghost vessels, you can see. So methylene blue definitely helps, and since you are a cornea surgeon, we are not cornea surgeons, we are individual solo cataract surgeons, but we want to show you this, that you probably may be able to design some study techniques and take it up as a study of using UV and methylene blue for the treatment of very difficult kind of corneal cancer, even the conjunctivitis, adenoviral conjunctivitis.
Okay, thank you, Dr. Kakadia. Before we move on to the next topic, ivermectin, last comment from Dr. Antika Prahasta from Indonesia. Stop the slides. Mr. Sanjay, can you mute yourself? Sanjay Prahasta. Can you mute yourself? Some disturbance was coming. Dr. Antika Prahasta, please unmute yourself.
Yes.
Yeah.
Thank you for the nice presentation. I want to ask about Dr. Kakadia. Are there any incident of severe COVID patient who have recovered with methylene blue and then get back with COVID?
I'm sorry, will you please, sir, repeat the question?
Yeah. Are there any incident of severe COVID patient who have recovered with methylene blue and then get back with COVID? Yeah. Relapse again. Because yeah.
No, sir, I am an ophthalmologist. So what I have treated is a very limited number, not very severe cases, but probably Dr. Golwalkar can answer, or Vishnu and Dr. Raut can answer.
See, my protocol is that till today, not a single patient has come with relapse. Second thing, I advise him to go on taking inhalation till the oxygen starts recovering. Means, for example, if your oxygen saturation is 97, you ask him 20-meter walk test, it goes down and comes up. When all the bronchi are opened up, and when he comes back, it goes to 98 from 97. That is an indication that now I can advise him to stop taking inhalation. And this protocol I have been following. He has to take inhalation for about 1.5 months. Not a single patient has come with relapse. And when, as I advised, gave immediate inhalation, not a single patient of mine has developed fibrosis, which I have shown the photographs. Not 1% has come with relapse. So my experience in 8 months, no, even in TB, not only corona is a new product for me. In 10 years, I've been treating TB patients, those patients who have been cured of TB, where it is very common to have relapse. Not 1%, I must have treated more than 10,000 patients, no mortality, excepting few XDR, but otherwise no mortality. But not a single patient has come with relapse. So methylene Q has a tremendous potential to treat these illnesses. Corona is a new, and it is an active, immediately you have to act. But even in TB, which is known for the relapse, even there I didn't find a single 1% relapse. Of course, you have to act very fast. Means you do, as I told in the lecture, that moment you suspect, give the inhalation. That stops the progress of the illness. Then you get some time to breathe.
Okay.
Thank you very much
sir.
for you. Thank you.
Thank you very much, Dr. Golwalkar. Dr. Kakadia, can we move on to ivermectin now? we may be able to cover ivermectin today.
Yes, yes.
Let us see. Yeah.
Let us see when that.
Yeah. Please start your derivation on ivermectin.
Okay, fine.
Everyone else, unmute please. Mute please.
So ivermectin is another a drug which is repurposed. It is actually an anti-helminthic drug. He is Professor Satoshi Omura, who is a double PhD from Kitasato University of Japan. In 1970, he found a soil bacteria named Streptomyces evermethylis. From these bacteria, he found a compound ivermectin. Actually, he found that in certain area of Japan, the children who had helminthiasis, who had hookworm infestation, were given the clay to eat. Now, normally in all other part of the world, when the children they eat clay, they get helminthiasis. But here, this clay of this particular area of Japan was treating helminthiasis. So he was just researching that clay, and he found that Streptomyces evermethylis bacteria, which was producing ivermectin, was actually killing the helminths, and that's how that particular area's clay was treating this disease. So from ivermectin, a safer compound named ivermectin was derived, which is a very broad spectrum anti-helminthic drug. And this drug, after his synthesis, was being used by Dr. William Cecil Campbell, who is a PhD, who is a scientist, poet, and a painter from Madison, New Jersey in USA. He used ivermectin for the treatment of river blindness and elephantiasis in Africa, sub-Saharan and Central Africa. And Dr. William Cecil Campbell is the inventor of thiobendazole, albendazole, both of these drugs. And because of this, he had a connection with Dr. Satoshi Omura. So ivermectin was being used, and he found that thiobendazole and albendazole had only 65% cure rate, whereas ivermectin had 100% cure rate. And so ivermectin became one of the safest anti-helminth in Africa. And she is Professor Tu Yu, who is a PhD from China. And she synthesized a drug named as artemisinin from a plant Artemisia annua, which grows in southern part of China. And this is a very strong anti-malarial drug which kills the falciparum, Plasmodium falciparum within a day or two. So they three shared the Nobel Prize of 2015, Dr. William Campbell, Satoshi Omura, and Tu Yu for invention of ivermectin and artemisinin. And it's very interesting to hear Dr. William Campbell's Nobel lecture about how they came into the use of ivermectin. It is one of the safest anti-helminth, and it's on the essential list and the African Program for Onchocerciasis by WHO. And ivermectin's antiviral properties and possible use in COVID-19 was researched by Emmanuel Rizzo from Milan, Italy. And this paper indicates that the ivermectin inhibits the replication of considerable number of RNA viruses such as dengue, West Nile virus, Venezuelan equine encephalitis virus, influenza, and pseudorabies virus. And using the same mechanism, they have recently shown that the drug also inhibits the replication of SARS-CoV-2 virus in vitro, however not clarifying how it occurs. Now this is another paper which indicates that human immunodeficiency virus also is inhibited by the same drug. Simian virus is also inhibited by the same drug. And this is another paper which has come up from Australia, which says that replication of SARS-CoV-2 is inhibited by ivermectin. And 5 micromole per liter concentration of ivermectin inhibits the virus, and it reduces the viruses by 5,000 folds in 48 hours, according to this paper. The same finding has also been also been substantiated by another research done by Fatima Haidari, who is head of the ophthalmology at Awaz University of Medical Sciences in Iran, and her colleague who is Reza Garebagi from USA in Austin. So there is a lot of evidence which has come up that ivermectin works against the SARS-CoV-2 virus. Now the question is 5 micromole per liter in 48 hours does 5,000-fold decrease of viral load. But the dose is very high because 875 gram is the molar weight of ivermectin. So for creating 5 micromole, we need to dissolve 4,375 micromoles micrograms in a liter, and for a 50-liter body water that comes to 240 milligram. Now this is impossible to give, so WHO and US FDA said that ivermectin, although works against the SARS-CoV-2 virus, the dose is impossible to give. But there were 33 research groups in the world which thought differently. They all thought that it is not necessary to reduce the viral load by 5,000-fold. Now 5,000-fold means if you convert this 5,000-fold decrease into a percentage, it is 1/5,000 minus 100. That gives us the decrease of viral load percentage. So that is 0.002% minus 100 means 99.99998% of decrease. Now clinically speaking, in a human eye, in a human body, we really don't need 5,000 folds. In vitro, there is no immune system, so maybe you need this much concentration. But in a live person, there is an immune system. So we don't need 5,000-fold decrease, we just need 50-fold decrease of viral load. And 50-fold decrease of viral load is 1/50 minus 100, that is 0.02 minus 100, so that is 99.98%. So if we can reduce the viral load by this much, even if we can reduce the viral load by 80-85%, the immune system can take care of the remaining of the viral load. So to achieve this, instead of using 240 milligrams, we just need actually to use 2.4 milligrams single dose. Should be able to clear this much percentage of the viral load. And the mechanism of action was actually investigated, and I'm very happy to say that our Indian scientist, Dr. Parth Sarathy Sengupta from Indian Institute of Science and Education Research from Behrampur, Odisha, has come up, and his paper has come up on 11 June, where his group has found that there is a strong molecular binding of ivermectin to RDRP, that is RNA-dependent RNA polymerase enzyme, and helicase NCB enzyme. So this enzyme binding prevents the replication and the polymerase chain reaction. So the genome does not copy. Thus it prevents RNA replication almost completely. And this is another research which has come from Bhabha Atomic Research Center by Dharmendra Kumar Maurya. It has been published on 9 July 2020, wherein this paper says that ivermectin strongly and perfectly binds to spike proteins as well as ACE2 inhibitors. So ivermectin actually coats the spike protein of the virus as well as it coats the receptor ACE2. So the lock and the key both are coated so that the virus will not be able to enter into the cell. And there are enough evidences that ivermectin also has anti-inflammatory action and anti-cytokine action. And Dr. Amelia Carolina Sparavina has written a very nice paper which you can read on ResearchGate, and she has compiled all the 33 clinical trials which has been done around the world. And all the 33 trials have shown ivermectin to be extremely effective against this virus. You can read, this paper is about 100 pages long, but you can read every trial in that. There's another trial which has come up from Dr. Amit Patel, who is an Indian scientist working in Chicago. And according to his cohort study, including 704 ivermectin treated and 704 control patients, was derived from 169 hospitals across 3 continents with COVID-19 illness. The patients were matched for age, sex, race, and ethnicity, and comorbidities. And of these requiring mechanical ventilation, fewer patients died in ivermectin group. So even in a patient on ventilator, the death rate decreased from 21.3 to 7.3, almost 1/3. And the overall death rates were lower with ivermectin, 1.4 versus 8.4. So ivermectin, there are enough evidence is gathering up about ivermectin. It is an US FDA approved drug. It is on the essential list of WHO, listed at 6.1.2 number entry. So like methylene blue, this has to be kept cheap and untaxed and freely available in any country of the world. It is an anti-helminthic according to US FDA, but off-label use for head lice, blepharitis and scabies is described. I know several ophthalmologists who use ivermectin for blepharitis induced by Demodex. FDA has cautioned that 240 milligram dose for 5,000 folds is not possible to be given to humans, but as we saw in that calculation, we don't need 5,000 folds. And this is the literature on US FDA's website about the pharmacokinetics of ivermectin, and the adverse reactions are very minimal. And the dose could be 200 microgram per kilogram of body weight if the patient is above 80 kilograms of weight. And this is Professor Thomas Borady from Australia, and he is the person who is key inventor of cimetidine. And in 1981-82, he founded the triple therapy cure for the acid peptic ulcer, before which acid peptic ulcer was treatable only by surgery, either gingivigotomy or by duodenectomy. And he is credited for finding out cure for acid peptic disease in the form of cimetidine and ranitidine. And his evidence of lies by doing this in the past. And he has conducted clinical trials in Bangladesh and China under his captainship, where it has been shown that ivermectin gives 100% cure rate and zero mortality in 60 and 600 patient studies. This website, Trial Site News, is worth listening. This is about 28 minutes of lecture on ivermectin, but it gives you very in-depth knowledge where the clinical trials have been done and how the clinical trials have been done. This is a paper on MedRx IV, where this says in the conclusion that ivermectin was associated with lower mortality during treatment of COVID-19, especially patients who required higher inspired oxygen or ventilator support. There is a trial which has been nearly completed by Professor Eli Schwartz in Tel Aviv in Israel. And there's another study which has been done on 1,300 patients in Dominican Republic by Dr. Jose Redondo. And in 1,300 early stage COVID patients, they found almost 100%, 99% of them have been cured. And there's one study which has been conducted in Argentina, which is known as Golwalkar. There's one study which is conducted in Bangladesh Medical College at Dhaka by Dr. Tariq Alam on 400 to 500 patients. Cox's Bazar Medical College in Bangladesh has done a randomized control study which has been published, which shows 100% cure rate, and admission time decreased from 21 days to 5.9 days. And Singapore has launched a study, and they already have finished a study on 5,000 patients who came COVID positive, and these 5,000 patient study is also giving a very promising outcome that it works very well. There is already a study which has been concluded in Peru. So after all these studies, it has been come to a good conclusion that ivermectin 12 milligram as a treatment dose is to be given. Actually 2.4 milligram is enough, but almost all have used 12 milligram ivermectin because it's very safe. Up to 350 milligram is safe. So 10 milligram can be easily given. It is to be given with tablet doxycycline twice a day for 5 to 7 days, and tablet zincovit twice a day. Approximately 50 milligram of zinc is needed per day. Zinc increases your immunity because it converts the cytoplasm and tissue fluids into an alkaline medium like methylene blue does. It directly interferes with RDRP enzyme of RNA virus, hence it prevents viral replication. It makes cell membrane very tough for viruses to penetrate, so prevents viral entry. Zinc improves absorption from GIT and transportation of ivermectin to the tissues via blood, and it is essential for conversion of lymphoblast into lymphocytes. So in maturation of the cellular immunity, zinc is essential. So zinc is to be given with ivermectin. This is the paper about potential role of zinc supplementation in prophylaxis and treatment of COVID-19. And what is the role of doxycycline and azithromycin? These both drugs have been found to enhance strong binding of the ivermectin drug to coronavirus spike proteins and ACE2 receptors. Both have fairly strong antiviral activity also. They are not only antibacterial, they have a fairly good antiviral activity. Both have anti-inflammatory and anti-cytokine actions also, and antibacterial coverage against the secondary infection. And clinical trial on ivermectin named as ivermectin Borody study is also going on in the USA, which is about to be completed in January 2023, but we can't wait that long. And there's also one study which has been conducted at King George Medical University of Lucknow. The results are very promising. Even I found one newspaper press note that ivermectin tablet is being used in place of hydroxychloroquine in AIMS, in Lady Hardinge Medical College, and in Max Hospital in Delhi. So even in AIMS, hydroxychloroquine is being replaced by ivermectin as prophylactic use. And one of the wisest ruler of the country, Yogi Adityanath, Chief Minister of Uttar Pradesh, has already implemented ivermectin as a prophylaxis and as a treatment for the COVID disease. This is the circular issued by the UP government on 6th August, where it has been completely given, and the instructions are complete about prophylaxis in context, for prophylaxis in healthcare workers, and for treatment in COVID positive, how to use ivermectin. And recently I learned that the government of Karnataka and government of Andhra Pradesh and Telangana have also followed the steps of UP government, and in both these states ivermectin has been cleared for prophylaxis and treatment. Ivermectin 12 milligram once a day for 3 days, zinc-seed twice a day for 5 to 7 days, and doxycycline 100 milligrams twice a day for 5 days. This is ivermectin 12 milligram as a prophylaxis for prime contacts 2 hours after dinner on day 1 and day 2 with zinc and with doxycycline. And ivermectin as a prophylactic dose for frontline healthcare workers has been advised by UP government as 12 milligram per day, 2 hours after dinner, once a week. And of course, along with the zinc to improve the absorption. So ivermectin is another molecule which is very cheap, very freely available, which is actually an anti-helminthic which is available over the counter, which so far we have not opened our mind to, and it has now been being used by most of the physicians in India. So thank you very much, and maybe you can have questions on ivermectin. Of course, I'm not an expert on ivermectin, but Dr. Golwalkar uses ivermectin quite frequently or in almost all patients. So maybe he can give some previous. Sir, please unmute yourself.
Yeah, I'm using it and I'm getting very good results with that. Results are very good. Is speaker on Kilega?
Yes, we can hear you, sir.
Yeah. No, I'm giving along with other medicines, and the results are very good. Means all in combining this with other medicines, till today I'm happy. I must say that not a 1% patient has suffered or gone into bad state. Of course, if the patient comes with 60% oxygen saturation, I have to refer him. Otherwise, one patient I'll give an incident that he came from Rajkot in a car. At 11:30, his oxygen saturation was 85, and he wanted to go back. He said that I will not stay here. So I gave him all these medicine, inhalation, everything. I was worried. I said, told him, ask him to go to Rajkot, but keep one oxygen cylinder because these medicines takes at least 48 hours to give their prescribed results. Day before yesterday only he had been to me. He said that he kept oxygen cylinder for 1 day, but then he returned it back, and now he is absolutely fine with all these ivermectin and other medicines. So the results are very good and no toxicity. Their acceptance is very good. That's my experience. And not a single patient I had to refer for tocilizumab or plasma therapy. Not a single patient I had to refer. I'll tell you one incident that is I can never forget. One patient with 65% concentration, dangerous zone. He had been to me. That is worth sharing experience. I said that go to hospital, get admitted. He said that my all friends, whatever, they had a bad outcome. I said, then go to the private hospital. He said that I cannot afford. Then I said, no way out. I gave him inhalation. I gave him all the therapies and say, pray God now. He said, if I want to die, I will die at my home. Every 5th day, I went on asking about him and he was visiting me. He got totally cured and 3 days back only he had been to me by God's grace and by my grace. I don't take the grace, but he was absolutely normal. He was very firm about it that if I go to the hospital, the result was not good, so he didn't want to go. I could not afford. But ivermectin and this combination, other combination, whatever I'm prescribing, my prescription is ivermectin, doxycycline, azithromycin. I am combining all this together. Nebulization, I am giving acetylcysteine, I am giving ambroxol and zinc and multivitamin. That's what I am prescribing to the patient. And very rarely I think I haven't used till today remdesivir or favipiravir or tocilizumab or plasma therapy. I never had to. Only thing, as I put the condition that oxygen saturation 95 is ideal. I have got safety margin. If it is 90, I'm little worried, but then I just see that patient will inform me immediately whenever he gets, and it takes 48 hours only. Once 48 hours passes, this combination works like anything. Then I don't have to worry about him.
Okay. I have a question. For a normal healthy person as a prophylaxis, can he take only methylene blue, only ivermectin, or should he take both? Or both will be better?
What I am following for myself, we see Dr. Kakadia had shown it. I take sublingually in the morning, and when I close my clinic, because I have to deal with open patient daily, and I'm not protecting myself from any other PP kits or anything. While returning, I take nebulization for 10 seconds, so that whatever virus are lodged in my nasal mucosa or oral cavity, that I take it inhalation, and that is enough for me to protect. That's what I have been following. Because in the nasal mucosa, sublingually, if you take it, and my experience is some of the patient taking, they turn positive for some time. But what I feel that because it gives protection for 12 hours. If you take in the morning up to 6 o'clock, you are protected. But if you get an infection, but next day morning when you take it again, that clears the virus. That's what I have seen, because some of the patients had turned to me, they were positive even after taking methylene blue, but then I said, wait for a day, and tomorrow you take the methylene blue and go and check again, and they turn negative. That's what I have seen. So it gives protection for 12 hours. As Dr. Kakade has rightly said, he has adopted a very good technique, but what I feel that when you have to take antibiotics, so long as you are sick, you are meticulous in taking 12-hour tablets. But if you are not sick, you forget. You don't take evening dose. But here, they are not sick. For prophylaxis, twice a day, they may remember, they may not remember. So, but that is the most ideal one. That's what I am following. But I am taking inhalation. And he's taking, that is a new technique, very good device, putting drops into the nose.
Yeah.
Yes, yes.
Yeah. I have one more question. See, ivermectin, why the maintenance dose, prophylactic maintenance dose is once in a month, only one tablet per month maintenance? Is the plasma life so long? What is the reason?
See,
Sir, I think that's a wrong protocol. Once in a month, take it for 3 weeks and then taking it once in a month is needless.
Correct. But how come they came to a wrong protocol then?
No,
one will think of once in a month. That's
no. I don't know how the UP government has devised their prophylaxis protocol, but I personally don't feel it should be taken once in a week at least for healthcare purposes.
okay.
Once in a month is a very long day.
I would like to say one thing about it. The virus, information we got, it are dealt in 3 ways. Once they are in the macrophages, they kill it. That is way of dispersing the virus. Second way is the thymus cell. They deal with it, but then they develop immunity. Third way is the interferon, which leads for the cytokine storm. But the immunity develops only if they are dealt by the thymus cells. So you don't know what way body is dealing with the virus. So you are not sure that body has learned to deal with it. So this prophylaxis for 1 month, I don't agree with it. Even in TB, BCG, even if you take BCG or if you are exposed to it, on one side virulence and number of bacilli on one side, immunity and hypersensitivity of against the bacilli is on the side. What dominates, you are going to get sick. That is what they follow. So virus, I don't think it will once, because incubation period is very short. Once a month, if you take it, that is not going to protect you. I don't agree with that. Means I will not say it personally.
Okay. Is Dr. Danson there? Dr. Danson Mutual is from Denmark. He's there from the beginning. Dr. Danson?
I think he's there. He has to unmute himself.
Yeah. Dr. Sabyasachi Patnaik. Hello.
Yes, sir.
You have been listening to both the talks. Your expert comments, please. And I think you are in the Health Ministry of Odisha.
Yes, sir. Yes, sir.
Please guide us.
No, ivermectin has been prescribed as a prophylaxis for healthcare providers by the government also, with once a week dose. And coming back to the methylene blue discussion, I had also had this discussion by Dr. Kakadia, but I was not that much convinced as Dr. Namrata has told at that time. But today, with so many pulmonologists and general physician endorsing this, so I think it has a role. Then we should try this one, and it also seems very easy to use. Also, it's not very difficult to prepare and to use.
Yeah.
So I think let us start doing this and see the result. What happens to us? Then it will be one experiment also. So this is my view, particularly for this methylene blue. And ivermectin we are taking as a prophylaxis in Orissa. All the healthcare professionals are taking.
Yeah.
So if you if you take 1 drop of methylene blue sublingual in the morning, you will not need tea or coffee for 24 hours.
Oh.
So even for that, you try. Forget about the COVID, but just try it. Single drop of methylene blue, 0.1% sublingual, and you will not need coffee or tea for 24 hours.
Yeah.
One proof I would like to give, in Bhavnagar, 30 lakh population, the case in detection rate has come down to 10. Yes, today's morning is 11 only patients were detected.
Oh, very good, very good.
Only 11. Since 15 days, the case detection is around 15 to 20. Today only I got a message from Health Minister for congratulating me for the bringing down the case detection rate in Bhavnagar to 20 only. He himself congratulated me. That with these efforts of Sanjay Paranpe, I had requested Dr. Kakade for the same, because he is I am advising. I just said that when anybody is saying that it doesn't work, attack on Bhavnagar, any spot, wherever, if I get a patient from any area, I ring him, I say that in this area, from this area, I got 2 patients at that area. He's sending the bottles to that area, any surrounding villages also. If I get a patient from any village, small village, he is distributing, next day he is distributing bottle to that area. That's how we are attacking from wherever we are getting patients, they come to me. Or through newspaper, I come to know that the Shampara has 5 patients. Okay, next day I'll ask Sanjay Paranpe to send the bottles to that area. That's how we are bringing it down, and we have brought it down to today's case detection is 11% only. And Health Minister himself sent a congratulation to me for bringing down. So that's the proof it is working.
Can be placebo effect also, sir.
No,
Can it be
there is no, I strongly deny it.
Because psychologically.
No psychological effect. For ENT surgeon in last web seminar, I said that ENT surgeons are always worried about see placebo effect, the reversal of fibrosis. Do you have any medicine in the world?
That is correct. The X-ray shows reversal.
X-ray, this is one of the series. I have got hundreds of this type of patient. In one ENT surgeon, I had given a good news that they are worried about operating on a Cox lymphadenitis because the discharging sinus persists for 1.5 to 2 months. In this sinuses, if you drop, instill, if a patient comes with this, I ask them to get operated. I instill just 5 to 10 drops into that wound and give a small bottle to that patient, that whenever the person will come for dressing, drop few drops into that wound. 7 days their healing takes place. Now it is not a placebo.
No.
Ask any ENT surgeon, he will be worried to operate in coccidioitis. And that placebo, it is not a placebo. And I am not using any kit. I am ready to...
Not even a mask. You are not using mask.
Not mask. I don't need anything. I am so much sure because I am using since 12 years. Okay. Tuberculosis, I started with tuberculosis. When I noticed that it has anti-infective property, it is not an one incident I'll tell you that is very interesting. 3 patients it happened. Patients were, I was treating tuberculosis, asking them to come for nebulization regularly. They were coming. Then I stopped, noticed that they are not improving now. On inquiry, I came to know that they felt that they were quite better. They were symptom free. They had no problems. Then I realized they came to know that they have stopped taking medicines and they are taking, they felt that the inhalation is good enough to treat their TB. I started again therapy and they improved. So it is I think it is the add-on therapy. It is an add-on therapy. It is not a therapy. But it works in that. Again, I started I said you have to take the tablets, you have to take anti-TB drugs, but along with that, this is an add-on therapy. It is a immunomodulator. It is working in different way, and then started and they recovered immediately. In patient, this thing has happened. So that is it is not a placebo therapy. And
so ICMR should take up this as a study in multi-center studies.
That is up to them. I have requested, but it is up to them.
By ICMR, any good medical college in the country should take a lead and devise a study. We are solo private practitioner. We do not have the institutional backup and the capacity to do the study, but we are just describing what we have found. And I request Dr. Namita Sharma to talk to Dr. Randeep Guleria, who is a pulmonologist himself, and make a contact between Dr. Golwalkar and Dr. Randeep Guleria, who is the pulmonologist and the chief of AIMS. And if you can do just 20 patients, 30 patients pilot study at AIMS, it will open up a complete new venture, and I am sure that AIMS will receive Nobel Prize for 2021.
See, what Dr. Kakade always say that you must get Nobel Prize, but I got a very good explanation. Patients are coming to my clinic, and when they get improved, they say that you are a Bhagwan. I was talking to one of my brother-in-law. I said, why patients say that it is a feeling when you are drowning, you are underwater, you are suffocating, and when you can breathe, you feel as if someone has given you new life. That's what I said. Why every patient comes and says that you are Bhagwan, you are Bhagwan. So I was not wondering, because in TB patient, other patient I am treating, they said they are so much suffocating, they cannot breathe. And when you make them feel breathing, so That's why they call you Bhagwan. I said, I'm not Bhagwan, but I'm following whatever my guru had taught me. But that is what feeling they do have. And they are comfortable. So that is more than when they call me Bhagwan or they are relieved or satisfied. That is more than enough for me, anything.
Yeah, Dr. Danson, can you come in? Dr. Danson Muttuvelu from Denmark. Dr. Satish said you have to say something.
Yes, sir. Because since Dr. Namrata Sharma Madam is there on this panel, there was an AIMS group, which was a physician group, which had advised, say, ivermectin prophylaxis for day 1 and day 7. So nowhere it has been mentioned anywhere that prophylaxis is for 1 month. It is on day 1 and day 7. It is even for the primary contacts. When a case is detected, the primary contacts of the family are given ivermectin on day 1 and then subsequently on day 7. Meanwhile, they can be tested, and if they are found negative, they can be still added on day 7. But Kakade sir was telling that in UK, because they have got 5 days a week, they were taking once in 5 days. Am I right, sir?
Right. That's true. In UK, almost all the surgeons and anesthetists and gynecologists, they are regularly taking ivermectin since the beginning of pandemic. Many of our friends who have migrated to UK taking me this feedback.
Since this was discussed on a AIMS group only, so Namrata Madam should be aware of this.
Yeah, I am aware of this, and they have a fixed protocol they follow. Now, if I were to do the study, I would have definitely done it, and I would definitely do the study for corneal ulcer. The results are quite impressive. But I have forwarded, I've just now only by checking, I forwarded the message to Dr. Anant Mohan, who's the head of the Department of Pulmonology, and let's see what he says. He's also a very close friend of mine. We know each other since childhood, so I know him very well. So I'll get back to all of you on this. And Anant Mohan, incidentally, was also the pulmonologist we had in our first webinar when we did on COVID. So let's see what he says, and if there is a possibility, I'm sure he can do. As far as funds are concerned, the funds for any COVID project are not a problem nowadays at all. Even Institute also is giving intramural funds for COVID-related projects. So even if we can do just a pilot study, I will move the one on corneal ulcers as was shown. Whichever way the results go, one should do the study and do it this way or that way. That, of course, I can assure that I will do it. But as far as the study related to the pulmonology is concerned, let me see what he says. Then I'll get back to you.
Yeah, Dr. Golwalkar, you want to say something?
One patient had interstitial lung disease, rheumated RA positive, ANA positive, and she developed scleroderma. I was worried now, both autoimmune disorder she has developed now. I don't know to what extent I can help her. To my surprise, both things disappeared. RA turned negative. Even ANA, next time I tested it, turned negative. Now it is not a placebo. It is something astonishing finding I had. Even rheumatoid scleroderma disappeared and interstitial fibrosis disappeared. It took 3 months only. Within 3 months, she is not coming to me. I had to call her. She said that I'm absolutely fine. I don't need any medicine. ANA turning negative and scleroderma disappearing and interstitial lung disease totally. It was a fresh patient, means recently detected. As I told you that the condition is that oxygen saturation after 20 meter walk test, how much it goes down and how much time it takes to recover. She was taking just 7-8 seconds to recover, come back to normal, and CT scan was suggestive, ANA was positive, and during treatment only she had developed scleroderma. But within 3 months, she turned negative. I have to call her that I want your records now. I want your reports for presentation. If someone asks me for that only, otherwise this is the what I have observed. Now, how do you explain it? No, placebo cannot do this thing.
So from your words, sir, it appears that corona is conquered. But
It can
not
be.
so.
Yes, yes.
Yes, sir, absolutely.
But not so from the WhatsApp, WHO or ICMR or Government of India, anyone. So that's why that is the most conflicting thing about it.
That I don't
The
know.
WHO and Government of India realizes things very late. No. Even even the COVID identification itself was 3.5 months late. Lockdown was 2.5 months late. We should have only, see the Government of India, we should have locked only 21 international airports as early as February 15th. If February 15th we had locked all international airports, the corona would not have entered into India. But we locked down on 25th of March. So the government has its own speed of working.
My
But we are ready, me and Dr. Golwalkar, I mean, Dr. Golwalkar, not me, I'm just an ophthalmologist. We are ready to invite you. You please come to Bhavnagar at our expense. We will host you for 10 days in the best hotel in Bhavnagar, the 5-star or 4-star. And we show you the results. Of course, now we won't be able to show you the result because the patient will be nil within a week or 10 days time. But you please invite us to your pocket of COVID. Wherever there is rampant COVID, we too will come. And in your presence, under your observation, we treat and we make a certain area which you specify negative within 10 days. We will come at our expense, we will stay at our expense in your state, or whoever invites us, we will come there and treat. Me, Dr. Golwalkar and Sanjay Paranjape, 3 of us are ready to travel, and Dr. R.C. Shah. 4 of us will come, and maybe Satish also. We'll come with our UV device and with our methylene blue and negativize your entire city within 10 days at our expense. That's our open invitation or open challenge. You can come to Bhavnagar or you can call us to your place.
I think Kakadia sir, we all will come to Bhavnagar itself. Make sure that you just organize 3 or 4 rooms in the 5-star or 7-star hotel.
Absolutely, absolutely.
Will also join.
Absolutely, it will be our pleasure. आपके जैसे बड़े-बड़े मेहमान हमारे यहाँ कब है? छोटा सा शहर है हमारा तो.
नहीं हम बिल्कुल आएंगे सर.
श्रीनिवास को क्वारंटाइन कर देंगे आपको. क्वारंटाइन will quarantine you in 5-star hotel.
Basically, he wants to shift to corona-free area now.
So, I think it's now almost 9:41. So here we come to the end of this fantastic, one of the few fantastic webinars we had across in this pandemic times. So on behalf of our founder chairman, Dr. Amulya Sahu, and our today's moderator and the Karta of today's webinar, Dr. Boramani, and our Vice Chairman, Dr. Parikshit Gogode, our Chief National Coordinator, Dr. Satanshu Mathur, and on behalf of President ISMSICS, Dr. Debashish Bhattacharya, I thank each and every one of you for being here and making a wonderful discussion. Special thanks to our expert panel, Dr. Namrata Sharma Madam. Just to say a few words about her, I think she must have been very sincere since the school days. Sincerely attending all the schools, and at present I'm seeing her in most of the webinars being from the start till the end.
Start to end, yes.
So she still maintains those school days. I think she receives an award for the highest attending hours in any webinar.
Srinivas, may I add one thing? Dr. Danson is here from Denmark. He was asked by Dr. Boramani. Dr. Danson is here. Yeah, please.
Let Dr. Danson have his say, because 2-3 times we called him. He was busy. Dr. Danson Muthuri, please.
You can unmute yourself, please.
Yeah, please have your comments, please.
Thank you. It was very interesting to be here for today's seminar. And
please unmute yourself.
Oh yes, sorry.
Yeah.
And I think it was very interesting to learn about the country. Some of the things we've talked about today is something that's not practiced in most of Europe. But I think the trials that are going on is going to reveal some efficacy for methylene blue and other techniques as well. So I think it's good to discuss these topics and overall come up with new methods, being innovative in the things we do.
Okay, I think he's...
Please unmute yourself.
Yeah.
I may not It's not going clear?
Yeah,
it's coming. Yeah.
Okay, good. So I think in that way, I think it has been a very great seminar. So thank you for that.
Fantastic. Thank you,
Thanks for joining. Yeah. Dr. Srinivas, please continue.
Joining us today. And finally, I would like to thank the speakers. I don't know whether vaccine is going to come first or Jagdeep sir is going to break the corona jargon here. But definitely we are all looking for it, sir. I really thank Dr. Jagdeep Kakadia, Dr. Deepak Golwalkar and Dr. Ramesh Shah, who brought in, so you just opened the Pandora's box. And so many questions still remains in the minds of many people. I think with more and more such webinars, each and every point will get cleared very well soon. And we had a fantastic list of panel here. Dr. Prakash Marathe from Maharashtra, another innovator, Dr. Satish Sheth, who is also in the team and who also happens to be my close senior. Thank you, Dr. Satish Sheth. We are same from Hubli city, and I'm proud that he is also into Dr. Kakadia's team along with Dr. Shah and Dr. Deepak, and doing a lot of innovative work. And I thank Dr. Carla Pamela from Mexico, and Miguel Sarabia from Philippines, and Dr. Purendra Basin from Madhya Pradesh, Dr. Indra Mohan Rustogi, Secretary ISM-SICS from Haryana, Dr. Andika Prahasta is another person along with Dr. Namrata Madam who has been throughout in this webinar. Thank you, Dr. Andika, for joining from Indonesia. And we also have Dr. Sabyasachi Patnaik, who have been asking a good question, very practical questions he asked at the end, and I hope that Jagdeep sir answered that very well. And lastly, I would like to thank Dr. Danson again for being with us in most of the ISM-SICS hosted webinars. And I think we come to the end of this. Anything you can just talk about, we can just stop the recording. For all the viewers here, it was a great evening with a lot of discussions. Hope we sleep with most of these things tonight, and have a great night. Thank you very much.
Thanks to Entered also.
Yeah.
Srinivas, I would like to interrupt for a minute.
No ISM-SICS webinars are as successful as conducted by the Entered Pharmaceuticals. So we owe a great thanks to their team led by Mr. Masurkar, Nikhil, and Rohit, Raman, and Rahul. Thank you very much.
Yeah, Dr. Kakade, please.
Yeah, I got a figure from Dr. Edward Sanjay Paranjipe that he and his team have distributed 3 lakh bottles of 200 ml methylene blue in various parts of India, wherever they could reach. So that's a phenomenal work. Distributing 3 lakh bottles of 200 ml methylene blue free of cost and mobilizing resources for that is phenomenal work.
Methylene blue is also available as a homeopathic medicine. It shows in the
Yes, sir. It's a part of the Materia Medica.
Yes.
John F. Clark's Materia Medica mentions 5 or 6 pages about methylene.
So before homeopaths claim that it is their way of treatment, we must claim it.
Fine, sir. Kakadia, sir.
Ji, sir.
It will go on, sir. A whole night it will go on.
Yes, yes.
And those who are interested can stay back. And I think let's say a good night to the rest of the people who want to carry on. Thank you very much, and wonderful webinar, Kakadia, sir. Deepak, sir, and Dr. Shah and Dr. Sheth. You did a wonderful job. Thank you very much.
Srinivas,
yes, sir.
Srinivas, I would like to add something. To all the panelists, Dr. Srinivas Joshi is the blue-eyed boy of Hubli Dharwad Ophthalmic Association. And now he will move on to become ARC chairman. And one fine day we'll be seeing him as the secretary of the AIOS.
So before that only I will quit. Namrata madam is all smiling here.
One incident, 4 days back only, one lady came to me regarding good night sleep. She came and gave me thanks. I said, what for you are giving thanks to me? She said that you are insisted my husband to take methylene blue. The day he started taking it, he has stopped snoring. I can sleep quietly.
So this is another advantage of taking.
Yeah.
So methylene blue
having sleep apnea.
Yes, yes. So when you put, this is my experience, when I put the nasal drops, within 15 to 20 minutes, the nose becomes so clear, so much unchoked.
Decongestant effect.
So much easy to breathe.
So it has less side effects and more side benefits.
Right.
Thank you, sir. Thank you very
Right,
much.
sir.
Thank you
Thanks,
so much.
everyone.
Thank you all of you.
Very much.
Yeah.
Thank you, one and all.
Thank you. Thank you. Thank you.
Okay,
for-
thank you.
Thank you, Noor.
Good night, everyone.
Yeah,
Thank you.
madam.
Thank you.
Yeah.
Bye.
Thank you.
Thank you.
Dr. Sahu wants to say something. Your audio is not clear.
Sir, audio is not coming.
Your audio is not coming.
Your audio. Just unmute yourself, sir.
No, he's
unmuted.
Already unmuted.
It is unmuted.
बोलो sir.
Can't hear.
आवाज नहीं आ रहा है. We can't hear you.
You can hear me?
Yes, yes.
Now yes sir. Yes sir.
Yeah, Namrata has been always kind to us.
Oh, thank you, sir, for all the kindness. Pleasure.
Sir, that's why I keep saying AIOS is in the safe hands.
And Sabyasachi, you take up the challenge Kakadia has given you.
Yes, sir.
And then Odisha is now suffering from COVID a lot. So do something, take up one sector and focus on that.
Okay, sir. Let me start first and then I will propagate this message.
Right. Thank you all.
Thank you.
Okay, no.
Okay.
Thank you.
Thank you so much all of you.
Thank you
so
very
much.
Thank you,
Bye.
Danson. Thank you.
Yeah. Thank you, Ransom.
Thank you. Bye-bye.
Bye-bye.